Thank you, AIS. Thank you, Rohit sir, for this chance. I'll be speaking more on epithelial mapping and role of AI. I think very beautiful discussions regarding the utility of MS39 has already been done. Now, I'll not go into details. There are various epithelial tools, the spectral domain and the Placido topographer. MS39 has revolutionized the way we manage and prognosticate patients post-operatively. But sometimes it's necessary to look at the book cover and just not delve deeper initially. Now, epithelium as preoperative determinants is very important. Cases where we are doing preoperative planning, sometimes there's a match between cylinders. I understand that there are other components such as lenticular aberrations. Sometimes epithelial irregularity can, throw us off the roof. So ideally, if you're looking at refractive surgery, you're looking at keratoconus and not only diagnosing and also following up these patients, it would be at the level of stromal elevation. So that's an important tool and usefulness of preoperative workup and preoperative importance of epithelial mapping. And also post-operative, there would be various ways, if you're looking at myopic correction or remodeling for a hyperopic correction. Epithelial and understanding epithelial disturbances or remodeling is something which can help us, and it fits many of these unhappy patients post-operatively could be because of epithelial issues. So that's where the importance of epithelial lies, not only pre-operatively but also post-operatively in both keratoconus as well as in refractive surgery patients. So why exactly this epithelium, and where exactly we looked at artificial intelligence, my topic in my PhD, is now what happens is many of the topographers we have in our armamentarium do not really dissociate epithelium, and epithelium can in fact be a masquerader for many changes, and it's at the stromal level is where we're actually supposed to be looking at a disease such as keratoconus, or looking at treatments such as in case of refractive surgeries before we actually move ahead. So where are we actually missing the buck? And are we actually measuring or looking exactly where we're supposed to be? That's exactly where the chunk of the matter lies. Now, prior to MS39, also we have our institute did develop a novel way of we had the Optiview earlier, where we we had nomograms looking at the air epithelium and the epithelium's Bowman's interface by doing the spectral domain OCT Optiview. And that helped us in mathematically subtracting the epithelium and just looking at the Bowman's. This is something which we presented way back in the last physical meet of AO, and this is the one which won. So we looked at how Bowman's topography not only helped us in in working up a patient, but also we were actually underestimating the outcomes post cross-linking, because we were not looking at the Bowman's level, we were looking at epithelium post-operatively, and what invariably happened is that threw us off the chart. So what we actually measure is the one in the blue, and what we should be measuring is the one in the red. And that's where the importance of Bowman's imaging and also MS39, which helps us in subtracting and looking at the stromal maps, looking at the true picture is important. So this is what an ideal imaging should be. I will obviously skip this and look at what we did in terms of artificial intelligence. Now, we spoke a lot about indices. We had good discussions about epithelial Zernike's, epithelial wavefront, lower order aberrations, higher order aberrations. But how do we actually make sense of it? What invariably happens is that when there are multiple indices, it's difficult for us to comprehend and make sense of it and connect it. That's where the challenge lies in using these advanced diagnostics or using these advanced tools. And MS39 per se, beautiful interfaces, but many of these indices is something which we cannot really make sense of. So what happens, if we're not able to connect the dots? We are in any topographer or in tomographer, we generally look at things which we are more used to, or look at indices which are more comfortable. And that's where artificial intelligence comes into play, my field of interest, where we look at other parameters other than the normal, and how there's an interplay between these parameters which can help us in either diagnosing or evaluating post-operative outcomes is what is important in these cases. So an important point in any AI algorithm is how we fit in the data. So like in the MS39 also, where we utilized epithelial derived indices, we fit in multiple aberration derived, which is not only the epithelial surface, we also looked at the Bowman's level indices, and whether it's aberrations, whether it is thickness change, whether it is meridional thickness change, and what quadrant thickness change. These are the multiple parameters which were effectively put into the artificial intelligence. One aspect of artificial intelligence is training the data set. Is I'm trying to teach the machine, I'm trying to teach the AI or the machine learning aspect of what it's supposed to look at, whether this is normals, this is FFKCs, this is classical keratoconus. The next aspect is how I utilize this data to validate it. And many a times, and what we do in our work is we have a cohort of patients, it could be hundreds or thousands of scans, and we do a subgrouping among the patients which you have done in machine learning. We take out maybe 10% or 20% of those data set and put it into the testing data set, so AI becomes more robust. There are various classifiers which we use when we're looking at artificial intelligence. There's something known as neural networks. People might have heard of something known as SVM or support vector machines. RF classifier, which is a multiple decision tree classifier, which basically is the one which had the highest accuracy in majority of our studies, or the highest area under curve. And that's the reason why we looked at the RF classifier. So we wanted to look at whether artificial intelligence, this is our first of the work on epithelium. We have done work earlier on epithelial Zernike's indices from the OptiView, and it actually accurately looked at post-operative, post-LASIK, SMILE, and PRK outcomes. This is another aspect, and one of the first studies looking at AI, linking it to AI, MS39 derived indices. And what we did is it was retrospective. We imaged multiple patients with both normal, both suspicious, a kind of a picture, as well as frank keratoconus, and almost 2000 scans of them were put into artificial intelligence algorithm. Again, like I said, we divided them into the training data set and the testing data set, and we wanted to look at what kind of indices and whether AI is able to discriminate or correctly classify patients, validating it based on the data we retrospectively put in. So that's what our main aim was. Surprisingly, majority of the indices which we put in, which included, so the MS39 indices not only include the epithelium, also included, the stromal derived indices and the aberrations of the stromal level as well. Bowman's, especially majority of the aberrations at the Bowman's level and not at the surface of the epithelium or deeper, was the one which was actually picked up. So that just validates our point, saying that the true identity of a disease, or whether it's keratoconus or where we're actually supposed to be looking at, is at the stromal level or at the Bowman's level. And it had a very, very high accuracy in classifying patients, whether they were normals, whether they were keratoconic, and whether they had form fistula keratoconus. This is just an example of the decision tree which we arrived at. Random forest classifier had the maximum area under curve and was the most accurate AI model. We do run it in multiple models, and the best model is what we normally arrive at. And interestingly, of all the scans, it had a very, very good accuracy in detecting normals, and the challenge lies in FFKCs. And even in FFKCs, it had a very good sensitivity and a very good accuracy. So this was in fact the first study which looked at integrating our understanding on artificial intelligence with both epithelial derived indices. MS39 gives us stromal derived indices as well, and that's what was important in this study. And this is something which we have, we are in the process of, it's under review, where we looked at utilizing artificial intelligence for early diagnosis of keratoconus. Now, translation is, you can utilize this in clinics. The future translation would be where we, are utilizing many of this in aiding us in early diagnosis. This is an axial sagittal curvature map. Well, not too much of significant posterior elevation. BAD-D was certainly a little deranged, so was the biomechanics. Now, if you don't have a stromal elevation, this also can help us just utilizing epithelial data and giving us whether this patient is actually an early case of keratoconus or not. Though epithelial had certain changes, early donut-shaped sign is what we normally call if a patient is, suspected to have, maybe an early keratoconus. But in this case, we ran the AI model and validated it. This is one of our validating, our testing data sets. and it was adequate, it was correct in detecting that, through epithelial indices, which was corroborated by the MS-39 stromal elevation, that this patient was, well, not a keratoconic eye. So the challenge is obviously not only to restrict ourselves to epithelium or topography, is to integrate. And I think MS-39 is a useful tool which helps us in integrating both epithelial, Bowman's and stromal derived indices. Thank you for your patient listening.